This roundtable brings together voices that are essential to meaningful change: clinicians, public health leaders, policymakers, advocates, survivors, and community partners. Each of you bring expertise, perspective, and passion. Together, we have the opportunity to move beyond discussion and towards solutions.
Congratulations on this well-deserved honor, and may you experience continued success in your service to all Prince Georgians. Congratulations.
Being a survivor doesn't mean your life is ended. So I'm encouraging you to use your voice, advocate for yourself, advocate for your community, because tomorrow can't wait. Tomorrow can't wait because we need answers now. We need to know why the number of persons being diagnosed with colorectal cancer is younger and getting younger, and why so many persons are being diagnosed with a disease that is preventable if detected early.
It's important, especially in folks getting diagnosed younger than 50, pretty much all of them I will refer to a genetic counselor. We test all the tumors for a quick screening protein test to see, does the tumor look like it could be associated with Lynch syndrome? So that's a quick test that all the pathologists nowadays should be doing on any new diagnosis. And then if it comes back abnormal, then we really have to make sure the patient's getting what we call germline testing. That's testing the patient's normal cells to see if they've inherited something from their parents, because Lynch syndrome, the most common. The others are what we call polyposis syndrome. So not just like a few polyps, but people who get hundreds, thousands of polyps where their whole colon is filled with polyps. And this again runs very closely in families. And those folks are at extremely high risk. They will all essentially get colorectal cancer, usually by age 30 or so. And those folks are usually identified earlier because they have a strong family history. They're often getting their whole colon and rectum removed because we know they're at very high risk.
Why are we seeing colon cancer? So, 1 in 5, so about 20% of those diagnosed with colon cancer now are under the age of 50. So why is that? So that's where we've seen the biggest rises in the rate of colon cancer, but we're seeing a smaller but also still meaningful rise between 50 and 64. The number one symptom of colon cancer is no symptoms. And so I really want to emphasize that, which is why screening is so important, because so many people have no symptoms until they're more advanced.
I was the first person in my family, and I'm going to say this, that I was healthy, had been a vegetarian for 20 years at the time I was diagnosed, ran almost 3 miles every day. So I was very healthy when I was diagnosed, even though it was in the middle of COVID. My research says it's every 10 years if you're over 50, but now 45 is the new 50. If you're detected or they detect polyps, which we know that the polyps are removable, and that's why we say colorectal cancer is the only cancer that is prevented if detected early, because if they do the colonoscopy and detect the polyps, they remove them.